Hello everyone. Today we are going to talk about ADHD. ADHD stands for Attention Deficit Hyperactivity Disorder. ADHD is a neurological condition that is marked by excessive inattention, impulsivity, and/or hyperactivity. The worldwide prevalence of ADHD is from 5% to 12% of school-age children. However, the prevalence of ADHD in Canada is estimated to be 2.1% among school-age children, which is low compared with other estimates. The Ontario Child Health Study reported a prevalence of 6.1% among children aged 4 to 16. And generally speaking, ADHD is 3 times more common in boys than in girls. Based on the American Psychiatric Association's Diagnostic and Statistical Manual, 5th edition, which is usually known as DSM-5, there are 2 major areas, which includes 1. Inattention, 2. Hyperactivity and impulsivity. Indications for diagnosing inattention include inability to focus on details such as making careless mistakes in school, at work, or during other activities. Having trouble staying focused on tasks or activities. Having trouble listening when being spoken to. Having trouble following instructions and often failing to finish schoolwork, chores, or other duties in the workplace. Being disorganized when performing tasks and activities. And have little interest in making mental effort on time-consuming tasks such as schoolwork or homework. Leaving behind essential items for tasks such as pencil, books, keys, eyeglasses, and cell phones. Being easily distracted and often being forgetful in daily activities. Indication for diagnosing hyperactivity and impulsivity include often fidgeting or tapping hands or feet, or squirming in seat. Leaving seats from classroom, office, or other situations. Running about or climbing in situations where it is not appropriate. Often unable to play quietly. Often on the go. Cannot or feel comfortable being still for long period of time. Talking excessively. Giving an answer before a question being completed. Unable to wait in line. Often interrupting others. Also, for adolescents and adults, they often taking over what others are doing. ADHD could be diagnosed by showing indication in either or both areas. For children up to age 16, 6 or more symptoms in each area have to be found in order to diagnose as ADHD. For 17 years old and up, which they are adults, 5 or more symptoms of each area have to be found. Symptoms have to be displayed for over 6 months in order for the patient to be diagnosed as ADHD. These symptoms must be evident in 2 or more settings, such as home and school, and cause difficulties in either academic or social setting on or both areas. ADHD is not a learning disability. Although many patients with ADHD have comorbid disorders, including learning disabilities, anxiety disorder, and mood disorder. Prognosis. ADHD can have a serious and long lasting impact on a person's life. It is typically noticed by the age of 7, and symptoms can appear as early as the age of 3. Adult outcomes. Males with ADHD are more likely to have psychosocial, educational, and neuropsychosocial functioning problems, while females with ADHD have significantly higher risk for antisocial disorders, major depression, and anxiety disorders. Adults with ADHD are more likely to develop a substance use disorder when they use legal or illegal drugs to control their symptoms. Educational outcome. Comparing with non ADHD young adults, ADHD young adults are far less likely to enroll in a 4-year college program. They are 11 times more likely to not enroll in any school versus enrolling in a 4-year college program. 50% of the ADHD group attended vocational or junior college versus 18% of the non-ADHD comparison group. 15% of them held a 4-year degree compared to 48% of the control group. 0.06% held a graduate degree compared to 5.4% of the control group. Occupational outcomes. For young adults with ADHD between the age of 23 and 32, they are 11 times more likely to be unemployed and not in school. They are 4 times more likely to be in unskilled occupations than in clerical occupations, and 6 times more likely to be in unskilled occupations than in professional occupations, 61% more likely to have ever been fired compared to 43% of the comparison group. 33% more likely to have ever been laid off compared to 13% of the comparison group. 53% more likely to have ever quit a job due to loss of interest compared to 36% of the comparison group. They earn close to $2 per hour less in wage than the comparison group.
What factors may cause ADHD? ADHD may have a genetic component involving a chemical in the brain called dopamine. A study found that the brains of children and adolescents with ADHD are 3 to 4% smaller than those who don't have the disorder. Children who have family members diagnosed with ADHD are 5 times more likely to be diagnosed with the disorder too. Lacking executive control of the brain over motor and more primitive functions could be another cause of ADHD. Premature or low birth weight child are more at risk. People suffering from epilepsy are more at risk of ADHD as well. What treatments can we use for ADHD? Stimulants such as Concerta and dexedrine are common medications prescribed to medically treat ADHD. Stimuli prompting the activity of dopamine and noradrenaline in the brain help arouse the executive center of the brain to control more primitive areas of the brain. Keeping a healthy diet. Eat high protein and low sugar foods. Why high protein? Because the chemical structure of the brain neurotransmitters are protein-based. Also, intaking regular zinc and iron to regulate dopamine level helps avoid inattention. Exercise a lot. One of the symptoms in ADHD is being fidgety and restless. To release the energy, they need to get plenty of exercise, such as bike riding, swimming, and playing soccer. Behavior modification. As a behavior analyst, we should be familiar with all strategies to shape appropriate behavior, such as using rewards to encourage a desired outcome. Rewards may include praise, privileges, or a token economy system. We could also implement evidence-based interventions to build social skills, such as antecedent-based intervention, prompting, task analysis, and differential reinforcement of other behaviors. Cognitive behavioral therapy is another effective way to treat ADHD. It helps identify irrational beliefs by challenging and ultimately negating these beliefs and feelings through discussion and home exercise, which typically include keeping thought logs. Local resources. There are over 76 local ADHD clinics located in Ontario. The Kids Clinic, located in the city of Ajax, provides ADHD assessments and treatments for children and adolescents by using ABA, biobehavioral constellations, and other strategies. Springboard Clinic, serving ADHD patients of all age groups instead of only young patients under the age 21, like most of the other clinics accept. Integrate Health Services is another ADHD clinic. They have a multidisciplinary team providing a variety of holistic support services for individuals and families managing ADHD. Their services include a variety of support groups, counseling services, parent support, occupational therapy, ABA, IBI, speech and language therapy, and behavior constellation. If you are interested in ADHD, you can go to www.canada.ca/ADHD for more information. They are all here for help. Okay, guys, that's all information today about ADHD. Thank you for watching. See you later.